I think if you have a new diagnosis of a long-term condition, just be aware that you don't need to let this condition define you. You're still the person you were before this condition.
The very, very hardest thing that I feel with getting any health label is to accept it. It takes a lot of effort and a lot of guts to accept it. The next thing is to know that you're in control of your future.
It can feel very overwhelming, especially if you obviously have been doing your research and health practitioners are talking to you about things like your health outcomes, risk, probability, etc. What I would say is live in the moment, plan for the best and take each day as it comes. Because with chronic conditions and, with life in general these days, you just don't know what's around the corner. So it's better to live in the moment, do the best you can, and arm yourself with information either way.
The best thing is to accept what's happened and to get as active as possible, as quickly as possible, by seeking advice, looking at alternatives, and really thinking about where you want to be in the next 5 years, 10 years, whatever. So long-term planning, because once you have a chronic condition, that's what chronic means, you've got it until the end.
Just reflecting on when I learnt that I had, a vision impairment that was going to really affect my life, I think taking the time to research it and find out as much as you can about it, and perhaps seek out other people who have gone through or are going through a similar thing, to see about how they manage it. But just research, find as many tools and as many things that can make having that condition as easy as it possibly can.
When a person has a long-term health condition, it is very helpful if you really understand what the condition is all about and what sorts of things you can do in your normal daily life to not let it get worse and to be as well as you possibly can be. And that probably involves asking lots of questions of your treating health professionals.